The Canadian Club of Halton was host to Dr. Blair Bigham, an award-winning journalist, scientist, and physician who recently had his first book published.
Death Interrupted is a book about this dilemma we have where medical technology sometimes doesn't do what it's intended to do. It prolongs death rather than saves lives. And dealing with that is stressful and at times really emotional. And so by writing the book, I was hoping that I'd come up with some clarity for myself and along the way realize that it might help bring clarity to other people as well.
Every time Dr. Bigham attaches a person to one of these potentially life-saving machines, he hopes for the best, but technology and modern medicine can only do so much.
A lot of people think of healthcare as, especially critical care or emergency medicine, as saving somebody's life. And so we always want to make sure people don't die too soon. We want to jump in with machines, technology, drugs, surgeries, and try to save someone's life. But everyone has to die eventually. And sometimes, despite our best efforts and despite all of that science and technology, it becomes clear that we're not going to be able to save your life. And at that point, it can be really hard to decide when we switch modes from keeping someone alive longer, trying to help them recover, to instead focusing on their comfort and recognizing that their death is near.
This decision of when to switch to palliative care is often that of the patient's loved one to make during an incredibly emotional time, which is why Dr. Bigham advises having these often neglected but critically important discussions in advance.
Ending up in the ICU is not something most people plan for. When it happens, it's often under sudden or tragic circumstances, so you can't really have the conversation about, oh, well, what do I want to happen to me if I were dying and the machines weren't working? That's a conversation that you have to have sort of now or tomorrow, because you don't know when the fruits of that conversation will come to be. So having that conversation with your loved ones, with the people who will represent you when you're not able to speak for yourself, is really important. I think a lot of people put it off, they delay, it's an awkward conversation. First, you kind of have to have it with yourself to know what you want, what you value, before you have it with other people. It's hard, and people put it off. And in my line of work, I see people who have never had that conversation, and it can make the end of their life really difficult to sort out because we don't know what they value and what they don't value. And their families can struggle too. So having that conversation ahead of time with you, yourself, an internal dialogue, and then with your family, will pay dividends.
For more lessons learned and the previously untold stories of patients and healthcare providers and the systems that help or fail them, Dr. Bigham's book is available at A Different Drummer Books in Burlington. For Halton News, I'm Jessica Kaitting.